So you have your Nestle water there, good.
No, actually, it's brand X.
No,
sorry.
that is Nestle,
Oh,
actually.
yeah, but this is-
They own Pellegrino, in fact.
Oh, I didn't know.
You didn't know that? Yeah, that's partly why they're sponsoring it.
Yes.
They want people to know that. So
Now you know.
Esther Dyson is a hero of tech, and now she's becoming a hero in a new space of wellness and health. And she has this amazing project, which is not a company, it's a project called Wellville. And she has established very extensive beachheads in 5 mid-sized American cities. And I'm going to ask her to explain, am I wrong already? I get things, it's so hard to explain this thing. Okay, why don't you just explain what you're doing with Wellville, but before you do, I want to say, Esther, before she got into this health thing, she created basically the whole model for this kind of conference with her Release 1.0 and an amazing series of PC forums. She was the incredible entrepreneur of tech and an investor, has been involved with many of the great companies, and it's all the more interesting that she's focusing on health and wellness. But what is Wellville? Why don't you just try to explain?
Thank you. So like Amy, following Amy's advice, I'm going to drive for daylight and not focus on my illustrious past, but the cool stuff I'm doing now.
That's good.
And fundamentally, Wellville is 5 communities, and if we could have the map, I'll just put it up here. Probably none of you is from any of them, but if you are, I'd love to give you a shout out. They're under 200,000 people each, which pretty much, unless you're Aspen, means that you have a lot of poor people.
So they're small, not mid-sized? Is that why I was
yeah,
wrong
and they're,
before?
they're
Okay.
not even cities.
They're not even cities. They're just areas. Okay.
They're sort of, they're communities. If you ask someone, where do you live, they'll say Muskegon, or they'll say Lake County, so they're places where people live, and they don't go in and out a lot. So if you start to create change in those places, it reverberates inside rather than dissipates outside because people commute somewhere else. So it's not like neighborhoods, but places where if you change the community, everybody in the community kind of feels it.
But they're very low income for the most part.
Low income, high disparity.
Yeah.
And so they reflect they reflect the bottom half of the country. These are the people who their children get damaged by the time they're grown up, whether it's child abuse or bad education or child storage instead of child care. Healthcare facilities are middling, the food is bad, and there's a lot of poverty. But it's not a nice white lady with tech coming in and fixing things.
What is it?
Yes. It is 5 communities out of 42 that applied when they heard there was somebody that was going to try and help them if they applied to make their community a healthier place. To apply, they had to be under 100,000, and then it changed and it was 200,000 for reasons too complicated to explain. There needed to be some kind of cross-sector collaborative that applied, and they need to fill out a pretty long and complicated application with data about what they had done so far, what they were trying to, what they had learned. And so it wasn't like just send us a letter. What they got was not money, and at the same time they didn't need to pay us. They basically got advice. We're not giving them fish. We're not even teaching them how to fish. We're helping them to think big and build their own sustainable fishing schools. So what that means is useful questions, ideas. They learn from one another. Each of the communities has one of us as their kind of coach, advisor. I go to Muskegon once or twice a month. I bring in people that I think might be useful. I tell them what's going on, And what we do is we look for the programs and the people that we think are going to be effective and make them more effective, because effectiveness spreads just like despair does. We're 5 years into a 10-year project. And so a few things I've learned.
I don't have to ask any questions. Good.
I'll keep going for a bit. I knew this would be interesting. I knew that you have to look upstream. The reason I started it in 2013 was I was investing in healthcare. Why are we spending so much money fixing things that shouldn't happen in the first place? Diabetes type 2 is almost preventable. We know what to eat. We know how to exercise more. We know how to reduce stress. We know what's wrong with abusing children. We know how to provide better education, but we don't do that. We don't do that as individuals, and we don't do that collectively as a society. So my solution to the market is not to destroy capitalism, but more to price in externalities, and I can talk about that later. In these communities, we have neither the money nor the capacity to do that. We try to model it and focus mostly kids, families, because it's helping to make the next generation healthy and resilient that will create that long-term change we're looking for.
What are the things you've ended up getting involved in that you were not expecting to get involved in?
Well, one, when this started 2013, Angus Deaton hadn't quite written his paper with his wife Ann Case about deaths of despair. The opioids were still something black people in ghettos did, and I mean that to be offensive. But suddenly white people started having drug problems and dying of overdoses, and then the establishment started taking more notice. And that, now you look back and think, how could we have missed that?
So that's a big issue in these communities.
It's a big issue, but, so I started reading, and I think it's on the Wellville list now. I read like 10 or 15 books about addiction and talked to people. The formulation I came up with is, and we'll go into Facebook and addiction in a moment. Addiction is short-term desire. There's a book called The Biology of Desire by Mark Lewis. It's the one I'll call out. You lose all perspective. You want this thing now, you need it now, and you have no sense of the past nor of the future. You're not trying to change things, you're just trying to, you don't have that 3D vision. Long-term desire is purpose. Long-term collective desire for the community, whether it's your community, your country, whatever, for society as a whole, that is can I have my quadrant chart? That's where we're trying to move our communities, but also our people. The local community organizations, they're addicted to short-term grants. We had this program for overweight ladies with Zumba dancing. That program has ended. Now we need, art classes for seniors, or let's just go grab some more money and do something, but it won't make any change. So there's this, politicians are addicted to votes and to re-election, and companies are addicted. So there's a difference between income, which sustains you, and which you need, and then this exponential growth, which is, you were talking earlier about Facebook and Wall Street. They're addicted to exponential growth, where you make your profits off equity expanding, rather than sort of making an honest profit. You need to have a monopoly, be, Adam Newman, I want to be the first trillionaire, that kind of stuff. And so Silicon Valley and tech is not the solution to these problems, even though there are some things you can learn, like pivoting and so forth.
Well, one of the more interesting things about it is it was such, you as somebody who is of sort of tech and knows everybody, to roll up your sleeves and really go into some of the most needy communities in America and make a 10-year commitment, that's so impressive and unusual. So I'm impressed by that. Talk about Facebook and this other kind of addiction that you've encountered.
Okay, so, addiction is, you can become dependent on a substance, and you can have withdrawal. But addiction is, again, this loss of focus on anything other than the immediate now and your own immediate satisfaction. Or it's not even satisfaction.
Sorry.
Yeah, I know. It's relief of pain in some sense, but it never leads to anything. And so, I thought like everybody, Facebook is addictive, that's a metaphor. But it's really not. And so one of the things...
You mean it literally?
I mean it literally. People do stupid things, they don't just want it and buy it, but people they stay up late, they ignore their families. There's what I call secondhand Facebook which is when a parent, instead of talking to its child, which we know is...
Like secondhand smoke, you're saying?
Yes.
Yeah. It's toxic.
It's toxic. The parent is texting, the kid feels ignored, becomes anxious, and there's something called adverse childhood experiences where kids are neglected, abused, whatever. But if you don't bond with your kid and talk to it, and that engagement often, it's not black or white, but the level of engagement goes down when the parent is on its cell phone all the time, and the kid feels neglected and ignored, and then becomes more needy, and the mother gives it, Coca-Cola in a bottle, and then the kid's teeth rot, and the kid cries, and the mother has an even tougher time interacting with the kid. And so, well, how do you solve all this? You have a lot more coaching for the young mothers. Ideally, you help them not become pregnant unintentionally. You pay living wages for people to do childcare, and you subsidize that childcare, because no matter what you feel about taxes or whatever, you're going to pay fewer taxes in the future if the kids grow up healthy, because they had a childhood that created the resilience, the ability to eat right, not to get addicted to bad food, et cetera, et cetera, et cetera. So some of the people we brought in, interestingly, not only is Walmart doing health care, they're getting much more interested in the health both of their associates and of the customers. And Doug McMillan is smart, because this is the right long-term strategy. Walmart is so big, it needs a healthy country. Because if people are just buying pharmaceuticals all the time and being sick and unemployed because they're not capable of working, Walmart doesn't have a business either.
Wow, that's an amazing way to think of it. Yeah.
Yeah, and so we're not store 8 or anything, but Muskegon is one of the communities in which they're doing some of the early trying to learn how to make it work better, because... And
you helped make that happen? You were involved?
We were present. We're more like a catalyst. We don't do things. We don't sign partnerships. So I don't want to overstate our role. But I knew the Walmart people and said, hey, you should come to Muskegon, because there's lots of community people that would be interested in working with you. Right now, they're referring diabetes, people with pre-diabetics, to the YMCA, which is running the diabetes prevention program. And so from my point of view, the goal of each of the Wellville 5 is for their community to be healthier, economic development, kids graduate from high school. We want them to do that and be very successful.
Are they competing with one another to some
degree?
No,
we thought they would. We thought it was a contest, but they said, no, we want to learn from each other.
Wow.
We get them together once a year. We have monthly coordinator. Yeah,
very cool.
Just, again, what Amy said, you learn better with other people around.
Yeah.
So at the end of the 10 years, and honestly before, to the extent we have data and stories, we want to use them as an example to inspire people. Everybody that cares kind of knows the data, but they don't do it. When they say, oh my gosh, did you see what they did in Muskegon or Lake County just north of Marin or all these other places? And then we have data. We have examples. We talk to policymakers. Ideally, we talk to voters and we want to be part of a movement that's much bigger than we are. We scale by people copying us, not by...
But the hope is the difference in health in these communities will be discernible and notable enough that it will really, in a way, help you promote it just by its very existence.
Yes, by telling...
I want to get audience in before we run. Yeah.
Health and well-being. It's not just measuring people's A1C or their cholesterol. It's again, are the kids healthy enough to graduate from high school? Are the people going to work, and is absenteeism reducing? And
you're starting to track all those things now?
They're tracking it already.
Yeah.
They were working on this before we showed up. We didn't come in and create something new. We came in and helped them.
And that would have been the case in most communities. It's just you're helping to put more structure around it, introducing them to other potential sources of help, and kind of taking a bigger picture view of what might be possible, right?
Yeah, like I asked the why, what would you do if you had enough money? And they said, we'd hire 2 more diabetes prevention counselors. And I said, no, enough money to fix the problem. Oh, so now they're on the way to 10 or 20. I mean, it's just being ambitious, having someone who has your back and makes
Very
you
cool.
think big.
It's just
Yeah.
so impressive. I just want to make sure the audience has their chance to marvel at it.
And
too.
can the slide person just put up our quadrant chart? Everybody
there a
needs
quadrant
a
chart?
quadrant chart. There is indeed.
Okay,
It's,
we may not have time for audience
it's just
questions
me
since
now,
hands aren't shooting up.
future, everybody.
What does that show, Esther?
It shows addiction at the bottom and collective well-being and purpose at the upper right.
Time of impact, yeah, who benefits,
it's-
shared,
We can have
long-term,
questions,
shared
they
benefit,
can look at
yeah.
it.
Beautiful, that's a beautiful chart. That's a poetic chart. Well, thank you.
Thank you, it was great.
So good to have you. One of the great people of the American